I'm Dave Breckenridge, and this is Under the Dome. Even as the number of new cases of COVID-19 wanes, the threat of highly infectious variant strains rises. That threat would mean a rebound in the number of coronavirus cases, resulting in more lives at risk and more lockdowns. In Alberta, current lockdown measures have been met with frustration by some and outright defiance by others, with some churches and businesses flouting the rules. Amid rising variant cases and frustration among Albertans, the UCP government has announced they'll be lifting restrictions in phases starting February 8th. The variant strains will be a challenge for the province, with Alberta Premier Jason Kenney trying to balance the ever-shifting pandemic while also easing restrictions on Alberta's economy.
My guests today are a couple of post-media columnists. We have Lauren Gunter from the Edmonton Sun, and we have Don Braid from the Calgary Herald. How's it going, guys?
It's okay here.
As we near the 11th month mark of some form of restrictions related to COVID-19, it would appear that some people in Alberta are getting a little tired. Fatigue is starting to set in, and I get the sense that some people have had, well, almost enough of it. Lauren, is that why we're seeing churches and restaurants flouting rules around masks, capacity, and even opening to begin with?
Yeah, I think so. And I think you're seeing that primarily in rural areas where there hasn't been an awful lot of infection. They think that they are being made to wear masks because things are bad in Edmonton and Calgary, and they resent the fact that the large cities are imposing this scaremongering on them. And yeah, they're tired of it. But they also don't feel, I think in rural areas, they don't feel that the government they thought they elected to represent them has done a very good job of that so far. So there's a couple of reasons, I think, that they're starting to rebel.
Don, what do you make of this? I noted the other day that Dr. Dina Hinshaw, the Alberta's Chief Medical Officer of Health, had tweeted some stuff about case levels in smaller centers in rural Alberta were starting to creep up, at least on a per capita basis. What do you make of the idea that people are kind of not either paying attention to that or tending to ignore that?
Well, I think it's a pretty natural tendency, if there's not a serious COVID problem in your area, to be a little looser about things. Remember the start, Dave, when Calgary was really whacked at the beginning last spring and Edmonton was drifting along without much at all, and it was because of more international flights into Calgary and spread. So I think, once it gets bad, people start paying attention. But, there's the ideological opposition. Some people just think that it's wrong to tell anybody to wear a mask, and you got that denial portion. Kenny's been very tough about those who break the rules. I mean, he's been pretty ambiguous himself sometimes about what the rules are, but when people break them, he does come down on that. Whether that has any impact or not, I don't know. But aren't we all tired? I mean, everybody's exhausted with this now. And then you got your compliers and you got your people who just sort of start to let it slide. And I personally think we're in a kind of a crucial period here, because if these variants catch hold and start to infect more, and we're into a deeper lockdown phase, the potential for more protests, for more total rejection of all this, it gets pretty strong. So what happens the next week or 10 days with the variants is really important.
Yeah, I mean, you touched on something I wanted to get at, like the idea that the Premier Jason Kenney, he appears, at least in press conferences and his messaging, that he's kind of starting to get fed up with people who are either skeptical or peddling conspiracy theories. I know he had a Facebook Live Tuesday evening where he was talking about how, everyone needs a hobby, but we have to quit it with the conspiracy theories. Do you get a sense that he's really fed up with the rule breakers and it's really starting to impact him?
Yeah, I mean, he's really fed up with the people in his own caucus. I mean, as much as anything else, what he's upset about are some of the rural MLAs who apparently have been kicking up a fuss in caucus and saying, you've got to release us. This isn't that serious. It's certainly not serious in my area, or X's area, and he needs them to tamp things down for, as Don said, probably the next couple of weeks, maybe the next month, until we can say that the variants are behind us, or at least we hope they're under control, and then he can start to release things. I mean, I think you saw that in a number of ways. You see it with Dr. Hinshaw, who says, yes, our numbers are coming down. She's very good. I think she's been very good through this whole thing about finding the balance between the public health zealots and the anti-masker types. I mean, there's both of those strains in Alberta, and she's been very, very good about leaving the province as open as possible and leaving up to the politicians the ultimate decision. But you can see there's a growing, as you said, tiredness about this, and Kenney's dealing with this at the caucus level. So when he says, he's tired of restaurants and businesses that aren't paying attention to this, what he really means is he's tired of the MLA from Pump Handle and Bug Spit coming to him every day in caucus or every day at his office and saying, we got to get rid of this. My constituents are growing frustrated with this. Everybody's growing frustrated with this. He is in particular. And I think he's really reacting to the people in his caucus, not necessarily to the Whistle Stop Cafe in central Alberta.
Don, do you get the sense that he's dealing with this among his MLAs?
Oh, there's absolutely no question. When he kicked out the guy, the Mexico guy, whose name eludes me all of a sudden, but Lauren, you got more memory left than I have. You name him. He said, the MLA said, well, now that I'm free, I can say what I think about the COVID measures in my riding. I can genuinely say what I think, and you get people like Miranda Rosen from up in Banff, and there's a whole whack of these people. So what Kenney does, as Lauren said, he comes down hard. Excuse me, I got another screen here. And he said last week, people thumbing their noses are being totally irresponsible. When they do it, they're thumbing their nose at the ICU nurses who've been working around the clock. They're saying their personal wishes outweigh the need to protect our healthcare system. He is talking background to some of his own people who think exactly that way, that you should be able to make your choices. Now, I don't think it's really majority sentiment. I mean, he's got the measures, they're in, but there's some difficulties there, that's for sure.
Now, Don, do you get the sense that kind of having to manage this within caucus makes him and the province a little gun shy from really cracking down on those who are violating the rules? Like, you didn't see a big crackdown on the Whistle Stop Cafe like you did at the barbecue joint out in Toronto a couple months back, or you didn't see a big crackdown on the Grace Life Church outside of Spruce Grove. Is that part of it?
He's always said that you can't punish people into compliance on this thing, although you can. The fines are big enough and you're made to pay them. You may just decide to comply. But Kenney himself has an ideological thing very powerful with him about freedom of speech, freedom of association, and all the rest of it. He really does think, I think, in a way that people do have some rights to question and maybe not comply to a degree. So very unwilling to impose penalties, such as been done in BC and in Ontario.
Lauren, what do you think it would take for the province to really crack down? Would it be a sharp increase in cases and then people violating the rules?
I'm not sure that it's in our culture to really crack down. If you look at the numbers of when we hit our peak in late November and early December, and when this new lockdown came in, the numbers had already started to come down before the new measures were brought in. Not huge, but the trend had turned. And I think that's because culturally, Albertans looked at the numbers and they said, okay, fine. We have to wear masks, we have to socially distance, we have to stand in line outside the grocery store occasionally when it gets over capacity. We don't like to do it, but we will do it. I do think a lot of this comes down to personal buy-in. Are people prepared to buy into it? And with the vaccines out there, people know vaccines are coming, with the numbers coming down, there's less personal buy-in than there was in November when we were hitting 16, 17, 1,800 new cases a day, when deaths were climbing up to 25 to 30 a day. People start saying, whoa, this is real, I better back down. And now they're starting to say again, Yeah, okay, fine. I'll wear a mask for a while. I'm prepared to put up with this another month or so. But boy, I'm getting really tired of it. So it doesn't have as much to do with whether or not bylaw enforcement officers in the county of Paintearth are prepared to give out fines as it does to people in Paintearth prepared to live with just the general spirit of the restriction.
Well, yeah, we're in a funny phase now because the cases are actually down into the 200s. I mean, that's a 90% drop since we were almost 2,000 a month ago. That will tend to make people less compliant. But we're heading into a crucial period here because if the variant kicks in, cases start to rise, then what happens to Kenney's 600 threshold for hospitalizations? I mean, he's really looking forward to this next step when he can get the restaurants back in business, because one of his more powerful beliefs, obviously, is the right of business to keep going as much as possible. So what happens if I think the variants are the real story now for the next little while, because we've got this one case, the location of which they haven't divulged, of the daycare with variant cases. So people, the plan is kind of ingenious in a way because it's got a fail-safe in it, the 600. If you go over 600, no more opening. You've got to keep pushing. So it kind of forces people to be compliant if they really want that. And but all those bets are off. And Kenney said that, I believe it was last night on Facebook. He said the variant issue is, if they take off, everything's out the window again. No more opening.
So, speaking of restrictions, we do have a clearer picture now of how things are going to reopen. 600 hospitalizations will be the maximum before they shut everything down. And then you have 450 to allow some more openings and so on and so forth. Is this just a natural follow to a drop in cases due to the restrictions in November and December? Or is this in a way to placate people who are kind of, as we've talked earlier, fed up with all the restrictions that they're under right now? Lauren?
Yeah, it's both. It is science based. They have looked at what they think the real projections are, what they can really control, and what doesn't stress the healthcare system. Mm-hmm. And they're looking at that intently because they have so many people who are pressuring them to open. I think it was interesting because yesterday we had Rachel Notley, the opposition leader, saying, "Oh, they're opening too early. This is awful. They're not paying attention to the public health." That's because almost everybody she represents has a steady paycheck, whether things are closed down or not. I talked to a guy yesterday who has a restaurant in a small community who has sold his house. He's drained his RSPs. He is trying to meet his payroll. He's got the bank wanting to get some payments from him, but they don't want to foreclose. All of this is that's the kind of stress that he's dealing with every day. And he's now my age, he's 62, and he's looking to start all over again. That's what this has done to people in the private sector, especially small business people. And Kenney is aware of that. I'm not entirely sure that the NDP are really tuned into that. So yes, I think both of this, that these are the measures that save the healthcare system from being overwhelmed, but they're also measures that are coming quickly enough that they might placate some of the pressure the province is getting, the provincial government's getting to reopen.
Yeah, you're getting this kind of division, and it's very powerful. Like I get emails and other comments sometimes from readers who say, "Well, easy for you to say, you've got a paycheck." Mm-hmm. And that is a powerful thing going on here. Some people are so desperate, like Kenney came down on the people who open, but some of those people said that they have no alternative. If they didn't open and get a few bucks coming in the door, they were going to have to close. Now, one of the saddest things I've seen is a person who owns in South Calgary some movie theaters, and she's basically taken to selling popcorn at the curb. Just to get some income to keep her business going. And I just found that sad. One sad story among many sad stories. But the Premier is, juggling this kind of thing every day. And I'm hoping, I'm sure if he crosses his fingers for anything, it's that the COVID lays off, because the case rate is quite good. And, in the States, the cases are starting to drop. These viruses do follow a pattern, and they do tend to surge monstrously and then fade. Maybe that's starting to happen with spring approaching, and who knows, let's hope so. So I think that maybe the lesser cases is due both to observation and compliance by people, and maybe some of that going on. Except for the variant, who knows?
Lauren, you touched on this a second ago, the idea that Kenney, despite having a fairly measured plan for reopening the economy and reopening society a little bit more, that he's taking a lot of heat. The NDP and others are saying, it's too big a risk right now to open restaurants and things like that. And on top of that, you have this issue around vaccines where the feds have been hit with shortages, and provincial premiers are taking a lot of heat from their constituents about a lack of vaccines, even though the problem is out of their hands. What is it that you think that Kenney can do to kind of turn things around a little bit in terms of the perception of how he's managing the pandemic?
No, I just think that whether Kenney does it or Tyler Shandro, the health minister, does it, they have to hit the feds every other day with the fact that it was their failure to make contracts with vaccine makers early enough that we're now stuck with no vaccines at all. And I know the rest of the world, there are countries that have their own supply problem, but nobody has the kind of problem we do. The federal government just sent to the provinces a series of lists of the vaccines that they expect coming in, and everything from the middle of February until the middle of March is left blank. And it says basically at the discretion of the vaccine suppliers. The feds themselves don't know when they're going to get large shipments of new vaccines. And this whole idea that we'd have 4 million doses by the end of March, I think is completely out the window. You saw yesterday with the feds announcing that they're going to start making vaccines at the National Research Council facility in Montreal, as though somehow that was a curative. There's no way that's going to happen until late 2021. Those vaccines are not going to have an impact on this until 2022, very likely. And so I think what Kenney and the other premiers need to do is just hammer the federal government again and again and again, because it's not their fault that they have no vaccine to give out. Roll out problems or not, you can't roll anything out unless you've got vaccine to roll out.
Don, do you think that's an effective strategy? I know that it's something that Premier Kenney has made no bones about. I don't think he's a huge fan of Prime Minister Justin Trudeau, and when it suits him, he's keen to use them as a whipping boy. But is the constant kind of beating about the idea that the feds have failed the province, does that make him appear like he's looking for a scapegoat, or is that an effective strategy to remind people that we're doing what we can with what we have?
It's total split. The people who want Ottawa pounded every day love it, and people who are more moderately inclined and more inclined to try and get along don't like it. But the reality for Kenney is that his approval rating on COVID is something like 28%. Why he would be 50% below the Premier of Quebec, who's got a worse COVID problem by far, is mysterious. They've spent a week in Quebec to figure that one out. He's done a good job, evidently, and people think so. Brian Jean today has written a letter that's in the Calgary Sun, a column in which he criticizes Kenney heavily for always wanting to fight. It's quite a remarkable thing for the guy who was a co-founder of the party and used to be the leader of the Wild Rose Party and a competitor against Kenney for the leadership, for to come out and say the very specific things he says, the problem in tone that he finds with Kenney's leadership, and particularly in him constantly snapping back. And he actually recommends that Kenney dump his own portfolio of intergovernmental affairs and get somebody else, a good cop, to do that. So nothing seems that he does seems to stop the slide in approval, which I think is also directly related to other things like the doctors and all the rest of it.
Now, Lord, do you think it's an issue of tone?
Oh, yeah, absolutely. Jason is not Ralph. I remember one time being on a panel on the national CBC that was talking about Buchanan in Nova Scotia and Mulroney in Ottawa. And one panelist said, Brian Mulroney's a tough guy to believe, even when you know he's telling the truth. And John Buchanan's a tough guy to distrust, even when you know he's lying. And Jason is a much more intellectual premier than Ralph Klein ever was, but he doesn't have that common man's touch that Ralph does. But Kenney tries always to be the expert, to be on top of it all intellectually, ideologically, and balance as many of the views as he possibly can. And that has made him, I think, look like he's overthinking everything and not going with his gut. And Ralph was just brilliant at dealing with his gut. And Jason just needs a little more of that common man touch, which I'm not sure is something you can learn. So if you don't have it when you come into the office, I'm not sure you can develop it while you're there.
You know, if you take a look at the comparison with Doug Ford in Ontario, who's still not wildly popular by any means over COVID, but he's doing a lot better than Kenney. And even though he says some spectacularly stupid things, Ralph did sometimes too, and people loved it.
Yeah.
But Ford has got that pain in his face. Like sometimes you can see such a human pain and pressure and stress behind the things he's saying, and he emotes them with real caring. And he sort of rides along all that. Although everybody's sliding, all the premiers, even Legault, have slid a bit in popularity. It's bound to happen over time, and the health experts are as well. But Kenney's problem is really quite spectacular. He's very low, and even the support, like even though he was low in COVID, he tended to be higher on vaccine until quite recently, and now he can't be high on that either. That's something that's genuinely not his fault.
All right, we'll leave it there, guys. Don Braid, Lorne Gunter, thanks very much for joining me Under the Dome.
Thanks, Dave.
That's it for Under the Dome. Don't forget you can find all past episodes at edmontonjournal.com/underthedome. Make sure you hit that subscribe button on YouTube. I'm Dave Breckenridge. We'll see you next time.